Hey, so today we're going to be talking about Achilles pain. So we get quite a few patients that come in clinic with that Achilles pain. And with this, the biggest thing we look at is, have they increased volume in their training? Have they increased the intensity? Have they increased that duration? So we go after that first of all. And then we do an assessment. With this, today I'm going to be looking at how that foot is taking up the load, as in how that foot is absorbing the load. Because if that foot has less absorption, normally then they will find their Achilles will start to become a little bit angry. When a patient normally comes into clinic with Achilles pain, normally the pain is around this tendon here, which is the Achilles, and it just runs up there. And we do a little pinch test. And we basically just pinch up here. It's normally around this mid portion, just around here where they would be complaining of a bit of pain. So we're going to look at how that foot takes up the load. So when I say foot taking up the load, that means how you are landing through that foot. So what we should see is when someone's landing on the floor of their foot should rotate in slightly and then push off. So if that isn't happening, then that load's going to be going up through that Achilles. So we're going to look at 3 movements which I'm going to test with a patient to see whether they're taking up that load. First movement we're going to look at is midfoot mobility twist. So all we're going to do is we're going to twist left and right. And with this, what we're going to be looking at is how that foot is moving. So whether it's rotating inwards and outwards. And next movement we're going to look at is a lunge. So I'm just going to lunge forwards, and with this we're looking at how that foot is taking up the load. Am I going on the outside part of the foot? Am I going through that big toe? And what we're looking at is that foot taking that little bit of load, so it's pronating a little bit there, so it's offloading that Achilles. And third movement, if we aren't in too much pain, we are going to go into a hop motion. So I'm just going to get them to jump up and down, and with this we're looking at how they're loading up through that foot. Before then we have a little look at getting some movements going on there. Okay, so now we're going to look at some exercises to help with that pronation of that foot to offload that Achilles. So first exercise is you only need yourself and a wall. Put both hands onto the wall, stand on that foot where you have the Achilles problem, and all you're going to do is you're going to drive that knee inwards. So letting that knee just track towards that big toe, and you do a twisting motion across your body, holding onto the wall. And then to progress from that, you are then going to come away from the wall, have that right foot in front, and then you're going to twist to that left side, allowing that knee to drop inwards to create that motion inwards of that foot. Give that a go.